Paperwork's tough. At the end of the day, I'm just massive headache. All right, I get headaches now daily. It's been going on for about 6 months, causing even sinus pressure. Well, the symptoms are affecting me every day. And I just wanted to get a normal workup and get it fixed.
Yeah. How is it affecting you? How about that? How's it affecting your work?
Greatly. Paperwork's tough. At the end of the day, I'm just massive headache. Family time is terrible.
Yeah.
It's everything. I'm probably about 15-20% better
Gotcha.
with the headaches.
So still overall not a home run, but as you were talking about last Friday when I treated you, how much better were you when you left? You leave my office.
Well, a lot better.
So the headache goes away.
You're right.
Gotcha. The problem with Gary, which is a chiropractor, is I give him instructions and he doesn't listen to me. So I'm not trying to pick on him personally. I'm just picking on people in general. When you come here, you got to pay attention to there's steps. These steps need to be followed. And the reason why is because he's missing the boat on understanding how pain develops. So he said he felt good on Friday, and the next day it was a little bit worse. And so I go, when did that happen? What was the problem? He doesn't remember. So anyways, notes.
Hardest part was the notes. I got to do the notes. I'm
Yes.
slacking on the notes.
Yeah. And it's, again, he doesn't realize how important they are. Once he starts writing them down, he'll start understanding how it is.
You scare me, but it works, so I just go with it.
I scare you?
Yes.
Oh, really?
Yes.
Did they scare you?
No, but I think you just said it deeper.
Yeah.
Just,
That's what she said.
that's right.
His headache is only maybe 20% better, he said. So I'm going to get the rest of it dialed in here. Feel right up here, right?
Yeah, a little bit like low on the atlas there, but yeah, that's a lot of attention.
You're welcome.
Yeah, I'll be feeling a lot better once you're done.
Yeah. As I tell my patients, I guarantee you'll feel better when I stop.
Yep. I agree.
Can't breathe. About how the APANs are going. Challenging.
Challenging, but I'm getting them. Shoulders relaxed. Pull forward. Straight ahead.
So the thing is when you're getting them, do you notice any change between doing them and not doing them? That's the big thing.
I haven't had the aha moment yet.
You haven't had it yet?
No, I mean, I can see slight things going or changing, but...
So when you start to feel some headache or some pain come on and you try to stop, you still can't get the pain to go away yet?
No, I mean, it might lessen a little bit, but it's not going away.
Gotcha. So we need to keep working on that aha moment, as he said. And the aha moment is when you actually can take control of your pain. As it starts to escalate, you can stop it. Okay, that's the big aha moment we're always looking for here. Good, nice. Whew.
Boy.
Down here. Oh my gosh. Yeah,
You got scared.
That's the problem. Yeah.
Instability there.
Good.
Oh, that's good.
Yeah, that's the problem, is that hypermobility down
Did you
there.
feel it? You barely touched it. It was like a 2-foot putt.
Yeah. Yeah, so anyways, Tubbs and Crockett here, Miami Vice.
So 1980.
Exactly. Only people that are old will know that reference. So why don't you tell us how you're doing? So you came in with grueling headaches a couple weeks ago now, and we've been working with you to get better. And so where are you at?
The headaches are getting much better. I mean, I'm not having as bad at the end of the day headaches.
So you still have them every day, though?
No, I've had a couple days I hadn't had a headache.
Okay, that's good, because it was every day before.
Yeah, it was daily before.
So you're saying the frequency is down?
Frequency is down so far, the intensity is down also.
Okay, so on a scale of 1 to 10, how much better is the intensity? I'm kind of curious.
I'm going to say probably about, when it's at its worst, because it fluctuates, probably 30%.
Gotcha. Now, what about the desk work? Doing the desk work on Tuesday, or did you do any desk work?
I did.
Have you challenged yourself yet?
I've challenged, I've done it, and I've had like
You
a
able to do
slight,
better?
yeah, I've had like a moderate headache, but before it'd be like, I'd be,
How much pain is this? Scale of 1 to 10.
that's a lot, that's about a 7.
About a 7, okay. So this is where your pain comes from. This is why I'm trying to get you to do APANs all the time. Because you don't do the APANs all the time, these are extra tight. Let's go this way. And this way. Good.
5.
Good. Still a 7?
No,
A
better.
little less, right?
A little less, yeah.
And so again, we change the structure instantly, which changes the leverage on the muscles, so he automatically feels a different sensation.
This stuff's gone.
Okay, so the one thing they wanted to know, I forgot, I was going to ask this question to him, is that, because everybody's like, he's a chiropractor, why does he self-adjust? And so I want to get your take on this, because do you tell your patients to self-adjust?
No.
And why do you tell them that, by the way? Let's get your take on why that is important.
Personally, what happens when you self-adjust, you're moving the segments that move too much anyways. You're not moving the fixation. It's a temporary bandage, temporary fix to relieve the stress or the discomfort. I don't know why.
Doesn't he act like a clown?
All right. Because it does release endorphins and Keflon, so it makes you feel a little bit better and decreases the pressure, but does not fix the problem. Even chiropractors need to be adjusted.
So why did you do it all these years?
I didn't take myself as a patient, and I just did the easy way out.
Okay, and so I'm just telling you guys that we're no better than you guys out there. And so he knows this, yet he couldn't just stop.
But yet, as me taking it serious and as a patient, I did the exercises, and my self-correcting, self-adjusting went to 0.
I think C5 is still the nexus of the whole problem, and he does the best overall with that. All right, good. Okay, look at that. That's awful.
That's that injury. I'm going to say the headaches, the intensity, and the frequency decreased.
Gotcha. What about percentage? Just give us percentage.
Well, I probably had them almost daily. So,
That's what you said in the first video, every day.
Yeah, so now I'm going to say maybe twice a week, maybe 3 times, but they're much less.
And what prompts them now? Still work? Still computer?
Still a computer, work a little bit, yeah. Those are like the 2 triggers.
Gotcha. And so are you able to work and do your reports on the computer better now? Or
Yes, I can work
you
longer.
concentrate longer?
Yeah, I can
Gotcha.
work longer and get more done.
Okay. And then, so the other question people are going to want to know out there is, again, how does this process feel different than all the other thousands of adjustments you've had? Because obviously we talk about this all the time. We could get adjusted anywhere, and he's been adjusted everywhere. We have tons of friends, great friends that are great chiropractors, have great practices, yet he's here getting better. Why? And how is this different? Because we want to know why is this different.
This is different because I think it's me more being a patient than a doctor.
I would say that's probably a big
probably
thing.
a big key factor.
That's
right
a key
there.
factor, exactly.
Being treated more like a patient. Also, the adjustments were more specific, more intense, deeper adjusting, and the support to do the exercises required to maintain those adjustments.
And again, a lot of chiropractors, again, the worst part about it, I think he said it even better than I could have thought,
worst patients.
is that we're the worst patients, but that he took this seriously.
Yes.
And then he became a patient. And the problem is when we give free treatment to our other friends, we're like, how's that? That's good, dude. No anything. There's not any instruction. There's not any really follow through. And they really don't even care about how you feel.
Well, also the other thing that I approach it differently is, I know when chiropractors get adjusted, I just hit my atlas here, or my C2, we're already given directions on where we want things. So I let you do the x-rays, I let you do the evaluation, and I let you be the doctor. That's the biggest key factor.
Again, I think he hit it right on the head. I wasn't even thinking this, that he became the patient. Rather than saying he knew better than me, he goes, well, let me just trust my friend.
Exactly.
And so I think you couldn't have said it better. I didn't even think about that. I'm glad you said that. That's probably the most brilliant thing that came out of this, is that when you come here, and not just doctors, but you as patients, don't come with a preconceived idea that you know what's going on. Because if you do, you're not going to get the help you need.
True.
And so he couldn't have said it better. So thanks for that. So anything else you want to say about me that they need to know? Not the dirty stuff, but only the good stuff about me and my wonderful... No, I don't even know where to go with that. Anyways, we play mean pickleball, by the way, now. We started playing pickleball, and my son and I kicked their ass last week, so I think I'm going to finish on that.
That should be an editing, because he did lose.
We lost one, but we ended up winning one. The last game we won.
Okay, yeah. I'll give you that.
But they kicked their ass already.
Come see him if you have issues.
Exactly. Yeah.
He's the guy.
Dr. Gary's in Anaheim, so he's really wonderful at what he does too. Good.
All right.
See you guys.